alaikum. In the name of Allah, most merciful and most gracious, High Excellency, the Minister for Health, the Federal Government of Somalia, the Minister for Health, Dr. Jamal, of Puntland State, the WHO Country Rep, Public Health Agency of Sweden representative, AFNET team, universities, authors, and scientific committees for this conference, and the Executive Director for NIH and Ministry of Health Directors present. I feel excited today to be in front of you. As I stand in front of you, when I reflect the process that we went through to culminate to this important conference, I would like to take you through, as Dr. Jama has said, my name is Mukhtar Bullale, the public health specialist, the research lead that I was coordinating this conference. And when I look at it 8 months ago that this idea was born. Next. This idea was born 8 months or so, and then the conference concept was developed and shared with the NIH Board of Directors, headed by Professor Khalif. And after several meetings, this concept was approved and discussion issued on this for this conference to be held this week for the last 3 days. Next. The conference preparation started after the concept was approved and shared with the Board of Directors, Ministry of Health, and all stakeholders, and then the scientific and organizing committees were established with clear TORs and approved. The Board of Directors approved this, and then the scientific committee consisted of able scholars, mainly from the Board of Directors, NIH Board of Directors, and they included Professor Khalif, Dr. Marian Warsame, Dr. Omar Maye, Dr. Amina Sikale, Neema Warsame, Dr. Abdurrashid Ali Warsame, Abdi Gele, and Dr. Mohammed Gezi Rayat. Then there was clear the task for the scientific committee for us to bring us here today was to review the abstract, and just not reviewing but mentoring the authors through different platforms, telephone, email, WhatsApp, and to develop, and they developed assessment checklist for assessing this abstract that we have had that were brought here. Next. Then we had also the conference committee, based on the concept that the conference committee included the budgeting. We had a budgeting committee, subcommittees, communication and awareness. We also had logistics that included transportation, accommodation, venue, and all that enable us to gather here today. And then forward was continuous meetings that were held to update and take actions as we neared the date. Next. Engaging the universities and state ministries, the Ministry of Health, both in the federal and state level. What happened we did was all local universities were mapped and profiled, receiving their contact details and engaging them. 32 universities were listed for this conference so that they participate. Direct contact with private and local universities, engaging them in meetings, explaining the objectives of this conference, goals, and informing them of this upcoming very important meeting. And what we realized, we have showed a lot of interest, and that's what you see in front of you. Engaging the Ministry of Health of the 6 states was also another task that we did, explaining the importance of their participation in regards to this this conference that we have gathered here today. Next. Then we did the call for abstract. The call for abstract, what we developed with the scientific committee, we developed an abstract guidelines and submission that were developed, disseminated to all involved universities, directly, public health institutions, and openly via all platforms for any interested person within Somalia, and even beyond that had anything relevant to the Somali context. Following this, we received 91 abstracts, and that were reviewed by the scientific committee that I mentioned. And out of the 91, 53 were presented in this conference, 38 were rejected, and out of these 38, 11 were realized after reviewing, they were already published, and others were slightly substandard, and therefore it could not be presented here. Next. Conference budget and programs. WHO and Public Health Agency of Sweden provided technical and financial support of this conference and positively responded to our request. Then I developed this budget and shared with WHO and FAS, and their response was positive, and that's what you can see as to be together here. And a 3-day program then was developed with the involvement of partners and all stakeholders, including all that were involved from the initial start. In the program, we had 6 sessions, as you have seen, based on the abstract and panelist presentations. Among them, as you have seen, was health systems, a category in health system, and we also had Somali health research, production, and dissemination, as you have seen in the panelists. Reproductive health was a key area. Maternal, newborn, child, and adolescent health was a whole category. And then communicable disease that you have seen, non-communicable disease, research, training, and capacity building that formed the 6 sessions. Next. We really also had some challenges, and then we learned also some lessons that the program implemented as planned, despite small challenges. That included a 3-day duration of this conference was too short for the content of this program to be well articulated. Problems of internet, as you have seen, were connectivity and related issues were also some hitches that we also encountered. COVID-19 concerns was also an issue that actually, as we went through this process, that actually hindered us one way or another. And even this conference, people who wanted to come were not able to be with us because of COVID-19. Preparation of such conference needs more time in future. I wish to acknowledge the Minister for Health, Dr. Fawzia Vikar, for her stewardship and able leadership to make us go through this process and enable us to be here today. I also want to acknowledge our counterpart, the Minister for Health for Puntland, for the cordial welcome and brotherly way of how we handle that. I wish to also thank the universities of this country for responding to our call for this to happen. All of us, I feel proud of you today, and that you have made this conference a success, and that is why we are all here. Conference Scientific Committee, with the able support and sustained support of the Scientific Committee, that this conference, abstract or studies, have been presented here today. I'm also very proud of you, and I sincerely thank you. I wish to thank WHO for their financial and technical support throughout this process. Public Health Agency of Sweden, I wish also to thank them for their continued technical and financial support. Affiliates, our close working relationship and working with us in all the times as we went through this. I wish to thank the director of NIH for his leadership, making us go this through, and members of other directors, the Ministry of Health. Without your efforts, we would not have been here. And I can tell you, this conference is a collective effort and not a single person. And that is why we are all here. And I wish to thank all of you for your participation and making us be here today and actually make us proud that this was a successful event and a history in this country, a turning point in the history of health research in this country. And as you said, in this era where the evidence-informed policy decision making, the way to go is research. It's not about the era where people say, I think we need evidence and quality data for better health service delivery in our country and the global at large. Thank you so much.